Good evening, and welcome to Healthcare Communication in the Age of Artificial Intelligence. How do we sustain the human side of medicine? I'm Bernard Bandman, and I'm Executive Director of the Center for Communication in Medicine, and I'll be your moderator for this Speak Sooner community education program. Artificial intelligence is playing a larger role in all aspects of our lives and becoming an increasingly significant component of the healthcare system. Medical institutions, healthcare insurers, and of course, patients and those who provide medical care are being influenced by artificial intelligence models. This evening, our panel will explore benefits and concerns about the use of a rapidly expanding technology that will impact all our lives. Now, in terms of if you have questions that you'd like to send in, please do that through the Q&A. And the panel will actually answer as many questions as time allows, and we have until 7:30. Now, I'd just like to take a moment and just acknowledge those people who have been very generous in supporting this program. And I'm going to just take the liberty of actually naming them because they deserve that. And we recognize that our support comes from actually near and far, although we're a Bennington, Vermont-based nonprofit. So I'd like to say Anonymous, the Alcian Foundation, the Bennington County Medical Society, Curtis Merrow, D.B. McKenna and Company, Dan and Abby Cloris, the Paula Auto Group, Doctors Allison and Eric Nemi, Dr. Brian Cunningham, Dr. Carol Salazar, Dr. Robert and Alice Pezelich, Edie Sawitsky and Michael Keene, Green Mountain Tile, GVH Studios, Jason Morrissey, attorney at law, Jeanette Roper, Jeffrey Mayer and Linda Chin Mayer, Jerome Construction, Joanne and Yossi Oseri, Kathleen Blatz, M&T Bank, R.K. Miles, Shelley Pazer and Gary Baranovsky, Victor Lewin, Wasik Tires, and the Winberg Law Office. Thank you. So now what I'd like to do is move right into the program and introduce you to our panel. Noah Prizant is a third-year medical student at Duke University in Durham, North Carolina. Dr. Lidia Schapira is a professor of medicine and oncology and director of the Cancer Survivorship Program at Stanford in Palo Alto, California. Mary Smith is a cancer patient and nurse, and she lives in Saranac Lake, New York. And Dr. Jason Touhey is a physician, a hospitalist, and he's Director of Informatics at Berkshire Health in Pittsfield, Mass. So now we're going to ask the question. What are the benefits and concerns of using artificial intelligence in medical practice? And to set the stage for our panel discussion, we're going to show you interviews of experts on the subject. So let's take a look at this video.
The greatest benefit is, of course, taking things off our plate that we don't like to do. It's funny, I often say to my students and my residents, you know, didn't you go to medical school and learn about prior authorizations? Didn't you go to medical school to learn about how to properly code a chart? And of course, the answer is no, we didn't learn any of these things in medical school. What we went to medical school for is to learn about diseases and treatments and how to help people be better, how do help people get better. You know, we didn't learn about any of this administrative stuff. And as it turns out, most of us hate it. So the biggest benefit is, can we take all of this stuff that we don't like about the practice of medicine and allow us to really focus on the parts that we do like about taking care of patients. And that's where I think the biggest benefit is going to be.
I think I'm hopeful that if we can kind of use some of this technology to, I guess, improve the efficiency and take some of the kind of the more non-human burden of the analytics and the working out working out things to make them more efficient in the system that can provide a little bit more space for the human side of things.
I can foresee a time where the computer will be listening to that interaction between the physician and the patient. The physician won't be distracted by having to enter keystrokes, or some physicians actually have scribes in their office. I don't know if you've seen that, but they employ people so they don't have to do those entries. They have someone else entering it or taking notes. But I see that time not too far distant future where the computer will listen in and it will automatically take all the data and sort of bounce it up against all of medical knowledge and bring to the physician those suggested types of things of additional questions the physician might want to explore, potential diagnoses or additional laboratory tests. So there's an enormous opportunity, for the artificial intelligence to benefit that physician-patient relationship.
While AI holds great potential, it's crucial to approach it with its integration with caution. Ethical considerations such as data privacy concerns, potential biases in AI models, as well as losing the human touch, the human side to healthcare are real concerns that we must pay attention to.
As a physician, as a medical educator, I worry that technology can run away from us and that people will become so excited about technology that they'll forget that there's a patient and a family that they need to attend to. I really worry a little bit about that we will pay too much attention or spend too much time looking at data insteed of also looking at the human being in front of us.
I think the biggest concern is obviously bias. All of the AI that we're that's coming to the forefront now is all based on it was trained on past data, and for the most part, that's how they make these models. And as is readily apparent, the U.S. healthcare system is incredibly biased, and systemic racism is just kind of baked into the way that we practice medicine currently. And so if we use all that historic data of our healthcare system to train these models, all of that bias and is just going to become part of that AI and that model. And that's really the fear. I think the biggest fear that I've heard is that we need to avoid kind of perpetuating that bias that's already part of our healthcare system.
From the bioethics perspective, bias and equity is also similar to the bias and discrimination. And this is a concern if AI systems perpetuate or exacerbate healthcare inequities because of biased training data. Dehumanization of care is a concern. Over-reliance on AI could lead to a decrease in human interaction in healthcare. And this could impact the patient-doctor relationship and the holistic understanding of patients' needs.
Artificial intelligence and the computers and information technology, that's amazing if we use it in the right way to collaborate, but let it be the human side in how it's delivered, because as a patient, I'm going to have confidence in my doctor because I know them, they know me. They might have acquired more information from outside. I don't need to know about that. I just need them to deliver it to me.
We should educate ourselves, work with people who understand the technologies, and have them design systems that support the mission of our work. And the mission of our work should always place the patient and family at the center. And we should always remember that these are individuals, people who are vulnerable, who need guidance. And we should think of artificial intelligence and other technologies as resources that we can use to help improve their lives and really to pay attention to what matters to them.
It's going to require a total new paradigm in regard to how we look at the training of healthcare practitioners at all levels. And those individuals obviously will need to be much more comfortable with technology and savvy interacting with it. So, you know, the nature of it is, as we design medical training programs, whether they be for nurses, nurse practitioners, physician assistants, physicians, specialists, at all levels, there's going to have to be thought given to the idea of how that physician can, or that practitioner can be most effective using the new tools that we have.
AI might at some point in time be better at making a diagnosis than me. It might have all of the knowledge of the complete knowledge of medicine, knows every diagnosis in existence, things that I've never even heard of. It knows all of the treatments that exist, all of the drugs, all of the studies can be loaded into the AI. So it may at some point become better than a physician at making a diagnosis or at coming up with the most optimal treatment. But what it'll never be able to do is sit down and explain to the patient what's going on. It'll never be able to offer empathy to the person whose mother is dying. It'll never be able to offer a human touch. And you know, that's I think I know my job is safe in the future because the computers just can't do that.
Together with me, they talk about it. They let me be the final person that makes the decisions after maybe they've utilized AI and they've gathered all this information, but they present it to me, and together we make a decision. But without that human side, I would not have confidence in medicine.
Well, I think our panel and some of our other video interviewees, which I'll talk about in a little while, really laid the groundwork for what is going to be, I think, a very informative panel discussion. So what I'd like to do is I'm going to ask the panel to elaborate on, in this first part of our webinar, on the benefits of AI in medical care. So I'm going to begin with you, Dr. Touhey. Being a physician and being very involved in informatics, can you kind of speak a little bit more about what you see as the benefits of AI?
Yeah, so as I mentioned in the video, I think the big thing is getting away from all of these administrative hurdles that we have to jump through in order to take care of our patients. Every day I have to sit down and I have to type into the computer what I think about is what's going on with the patient. I have to click so many boxes to make sure I, you know, meet all of the requirements for reporting and data analysis and that type of thing. And many of these things there's value to them. So collecting data for epidemiologic purposes and for us to understand what's happening with diseases, there's definitely value there. But it certainly is time consuming from a physician perspective to have to do all of these types of things. So in the future, could an AI do this for me? And maybe it's not even the so distant future. There are products out there that exist already where the computer can listen into the conversation between the patient and the physician and can understand that interaction and can understand the treatment that I've proposed to the patient and can generate that report for me. So I don't need to spend a lot of time doing that. And that's really a great use of the technology, being able to put through the prior authorizations that I talked about earlier. The computer understands that the patient has been on this medication in the past and has not done well with that medication and needs something different, needs something that requires that prior authorization. So I don't have to go hunting through the chart and figure out where it is. And one of the other big things that's really coming out in the electronic health records these days is the use of AI to summarize care. I'm a hospitalist, so I take care of patients who are in the hospital, and many patients have had dozens of hospitalizations or dozens of physician visits, and an AI can comb through all of those notes very quickly and all of those hospitalizations very quickly and generate a summary for me that I can very quickly figure out what's going on with the patient. So I can make some snap decisions, and maybe I still need to get into that chart and do a little bit of a deeper dive myself, but it can help me as I'm seeing the patient for the first time and understanding kind of what their general condition is. AI is also used quite a bit in I mentioned diagnostics is something that the future holds. Watson can make a diagnosis better than a physician, for example. AI is used in radiology and in pathology to look at images and just point out to the physician, take a look at this spot. This spot doesn't look quite normal. It's pattern recognition that the computer is very good at, particularly with a very large area. So the AI has, I think, a tremendous promise. We just have to figure out the correct ways to use it.
So I was going to ask you, Dr. Schapira, in terms of how you see the benefit in your practice as a medical oncologist.
Yeah, I think clearly I agree with everything that my colleague has just said so eloquently. I think I'm one of those lucky doctors who actually does have a scribe. So I, as one of your guests said on this video, so I know how wonderful it feels not to have to look at a chart. I can just say to somebody in the room, do you remember what the CAT scan said 2 years ago about this particular nodule? As I'm examining the patient, somebody's actually looked at it and given back that information. AI could do that for me. If I had glasses and, I could look at, all sorts of data, while I'm looking at the patients, or have an audio command, it could interrogate the medical record and remind both the patient and I, or the family member and I, that perhaps we've actually had a conversation about a pulmonary nodule or an adrenal nodule years ago, or that another physician involved in this patient's care has worked it up. So it could actually make us more precise. It could save time. It could relieve us the stress of the burden of some of the bureaucratic aspects. It could make it safer for patients if indeed there's a warning that perhaps we've missed. We've tried this medication before and it caused an adverse event, but it wasn't properly recorded. But the AI may be able to say, stop, think about this again before you do it. It may be able to look at films, if you can imagine certain settings or middle of the night emergencies. If you have phenomenal AI to look at a CT scan with you, I mean, currently we're sending these things to other parts of the world where there are people who are awake and reading them, but AI may be able to do that for you as well. So it's almost as if you can get an expert opinion, you can get a retriever of data, you can have somebody who assists you to do some of the meaningless, thankless tasks that are involved in delivery of care. And it can make care safer and more efficient, as long as you consider AI sort of another resource or a member sort of your team, and you don't focus exclusively on AI, which is what I worry about, that you become so enamored of what AI can do that you forget there's a patient.
Thank you. I'd like to turn to you, Noah. And you, of course, are in the midst of medical school and also some clinical training at this point. You've begun. So I think it would be really interesting to hear from you about what you're learning about the benefits of AI in your particular point in your education and training.
Sure. I think first of all, in medical education right now, I will say I don't think there's very much training on AI at all. It's kind of the type of thing where it's available. Resources are available if you want to seek them out. If you're interested in it, you can go learn more about it. There's definitely learning to be done, but as far as every single medical student, I don't think there's really much basic training in what AI is going to look like in the future, risks, benefits. It's kind of more of just discussion and things you hear from other students or other professionals or attendings that you're that are teaching you. And I think that's kind of almost a little bit of a disservice in medical education. I think obviously the incorporation of AI is coming, and it's coming pretty quickly, and there are going to be parts of AI that are implemented, before we know it, even in clinical care. And I think it's important to be aware of the risks and the benefits and how to use it, and when to use it, when not to use it, and how to kind of take all of that information into account. So I think really in the coming years, it's important to work that into the medical education, because it's going to be a big part of our jobs in the future.
And I think, you know, the reality is that it's not much part of a medical school curriculum right now. Perhaps many of the folks teaching medical school don't have a great understanding of it themselves. It's the type of thing that unless you're really in the thick of things, it's difficult to understand. And I think even many AI researchers have a hard time grasping what they've created. And there's many stories of people who create and work with AI, feeding training models into the AI model and having it do something unexpected, something that they don't understand themselves, how it came about with that type of information or that type of result. The way these AI models are built with machine learning, neural networks, they kind of just develop on their own. It's almost like an evolution of an animal that in some ways is unpredictable. And it's, just based upon what the training model is fed into it. So yeah, I think a lot of folks just don't understand it enough to teach medical students about it.
Well, we're going to come back. Thank you, Mary, because Mary, you wear two hats here, right? You are a patient and a cancer patient. You're a nurse. And so in this part of our discussion, it's really, I just wanted to know, what is it that you see as the patient as the benefit of AI in your care?
I'm lucky enough to have my oncologist when I first had cancer at 34. And then at 39, I had the same doctor. And now at 56, I have the same doctor. So he knows me. But in those 3 periods in my life, so much has changed. So much new medicines and new treatments. And just him being able to, he is going to gather the information from his colleagues and research, but him knowing me and the certain things about me is what saved my life. It wasn't, I'm not the textbook cancer patient. And, but he knows my history, and that's what saved me, knowing my history. And the insurance company didn't know my history, he knew my history. So that scares me. If I feel confident because I have the same doctor that knows me inside and out, not by, I'm sorry, I'm nervous, not by what he read on the computer. He knows me. So I'm sorry.
No, that's very important. We're going to cover a lot of that as we go on with our program today, just what you touched upon, Mary. So again, we just been talking about the benefit of AI, and you all just described it very well. But then there's the concerns and the worries about AI in medical care. And you've touched upon it a little bit, but I'd like us to elaborate a little more about this. And actually, I think I'm going to start with you, Dr. Schapira. If you could talk about what your worries and concerns are with AI.
I think Jason introduced this idea that that you can train it, but then you may get into some unexpected territory. And I think he might want to elaborate a little bit more. And that's a concern, not just in medicine, but in general right now, that people are voicing about AI, that you basically can do very good training, and training is based on what data you actually show the AI, and you have a ton of data. These neural networks and are incredibly sophisticated. They learn really well, but we're not quite sure sort of what they can do once they've learned this, and we're just beginning to see that. And so somebody like myself, who's not totally sophisticated but trying to catch up with colleagues here who are, can begin to get a slight glimpse of it, and I don't have the details. But basically, the way I would voice my concern is that the results of these data extractions may perhaps lead to mistakes that we can't anticipate right now. So that there may be some errors that are accrued and that people could get hurt as a result of those errors. And I can't quite anticipate. I'm sure Jason can give you a better idea. So that's one, that what they create, you know, dominates the clinical decision making, but that it's incorrect. That's one. And the other is, I think what I said before, that as with anything else, technology used without judgment can lead to problems, and problems that are either those that originate when garbage information is requested or generated, or when there's an interruption in the very important connection between patient and clinician, which we, I think, here all value. That's why we're here. I mean, you know, everybody who comes to your gatherings, Byrne, is somebody who already believes in the importance of the human side of medicine. So those are my main concerns. Basically, what I don't know, what I don't understand, and how this will be used in medicine if it's not used with wisdom and judgment.
Do you want to pick up on some of this, Dr. Touhey, what Dr. Schapira is talking about?
Yeah, sure. I think what she's saying is with a lot of wisdom. The judgment is so important, and will people become too overly reliant on these types of technologies? We already see this to some extent with computers and electronic health records as it is. We have patients who come to us and we ask them what medical problems they have, what medications they take, and they tell me, oh, it's in the computer. Or I ask my residents, you know, what medical problems does the patient have? Does the patient smoke? Does the patient drink alcohol? And the student or the resident isn't sure. They say, oh, well, let me look in the computer. So there's already a pretty heavy reliance on the computer and what information's in the computer without really using that judgment. You know, we had a laugh one time. We had a conference where we were presenting a patient, and the person presenting the patient forgot to ask, you know, said they weren't sure if the patient had surgery, and they said, no, I don't think the patient's had surgery. And when we went to actually look at the patient had a large scar in the middle of their chest and an x-ray which showed wires in their chest. And it was very clear, using just a little bit of judgment, that the patient did have you know, a surgical procedure in the past, but there wasn't the judgment that was utilized by this person presenting the patient. They relied on what was in the computer, which said no surgical history, because no one had actually put that into the computer. So it really does require some judgment, some thought. You can't be over reliant on it. The errors that an AI could make, it's always an interesting thing. They talk about this in like self-driving cars too. Will a self-driving car at some point be better than a human driver? And will a self-driving car never make a mistake? And so there's sort of this question, well, does a self-driving car, or does an AI that does diagnosis, is the requirement that it has to never make a mistake, or is the requirement that it just has to be better than a human? And if any of these technologies can exceed the capabilities of human, do we accept an error rate of whatever it might be as compared to the error rate of a human? And so these are important questions. One area that we can, you know, really see some guidance on this is when we look at a radiologist acting by themselves compared to an artificial intelligence acting by itself, compared to the combination of a radiologist and an artificial intelligence acting together. And we see that that combination is actually the strongest. Having someone who has that level of human judgment to understand what's going on with the case clinically, and the experience that they bring to it, combined with an AI pointing out things that might be present, you know, it's that combination that's really the most effective.
You know, again, what we're talking about also makes me think about what your comment, and also what the attorney and bioethicist mentioned, Adele Jasperese, in the video, and she brought up the bias aspects of AI. And so you, in the video, Noah, talked about what's baked in the data. and that's what's relied upon. We talked about racism and so forth. So could you talk a little bit more about this whole aspect of AI and the bias that may be in that data?
Sure. I mean, I think it was touched on pretty well in the video, but I think it's important to remember that AI is really just kind of a reflection of us. Ultimately, I mean, everything it's trained on is based on things that humans have created. And now that, especially now, large language models are kind of the newest wave in AI. That would be like ChatGPT and things that can understand language and produce language. And I'm sure lots of those are coming to healthcare soon. Those are just basically based on, you know, so much text that humans have produced in the past, and it's doing is trying to predict the most likely text that is a response to the question. And that's all based on things that humans have made in the past. So obviously, us as human healthcare providers, we're not perfect. We make lots of mistakes. We've created a very imperfect healthcare system. And so I think part of the concern is remembering that AI is created from what we have created in the past. We don't want to make any of the problems in healthcare worse by incorporating that type of technology. And I think that's something we just have to be very careful of and cognizant of when we're developing and implementing AI.
If I may piggyback on some of these comments, I would say that ideally we would construct our AI to correct for our bias so that it, moves us. So basically that we're holding more tension between positions to minimize, bias. The other is that there already are some papers, and I'm not an authority in this, and using AI to respond to patient messages on patient portals, to use ChatGPT to create, educational materials for patients, to, so it's here. It's not like in the future. People already have done it and reported on it. And the other is that, sometimes you can use AI even to create an avatar or something that responds to the patient in a very empathic way. I mean, we know how to do that as well. So there are all sorts of applications to use AI forms to mimic the human connection. And I think that to me is the part that's almost science fiction, because the data seems to indicate that these things are actually effective, that they may help reduce loneliness, that they may help improve communication, that may help people feel supported. And yet to me, it's kind of creepy because I'm still trying to understand how we got there.
So let me ask you, Mary, you're the patient, okay? So the question now we're discussing is about the concerns with AI in medical care. In this case, would be in your medical care. So what do you think about when that comes up in terms of AI influencing the care you receive?
One, I don't know much about AI at all, and I kind of wanted to go into this not knowing, but as we were during the interview, it clicked to me a couple of times that I've been affected by it and I really didn't understand it. You guys were talking about pre-authorization. So the chemotherapy I was on put me into heart failure. So they wanted to put radiation beads into my liver. So that goes to the insurance company. It gets kicked back. Because the first line of choice is chemotherapy, but that put me into heart failure. So we resubmit it, comes back. Nope, first line of choice, chemotherapy. And I don't lose faith very often, but I had lost faith. Went to my oncologist. He said, it's off the table. Don't worry about it. We've got lots of options. And at that moment, I was like, I'm going to be okay. Okay. So that what the data generated with my symptoms or what my labs showed, and it was just dead set on this is what you need. But my doctor, it was going to kill me if I kept doing it. So just by him saying, you're going to be okay, we've got lots of options, and I'm still here. But until I heard him say that, I was freaked out by that. So, and that's just data. And I called the insurance company, and the poor kid on the other end, I'm like, I need this, you know, and he's like, I'm sorry. And then I realized it had nothing to do with him. It was just an algorithm that had just spit that out. And, you know, so that was, I guess that was my one negative thing about it, but I'm still here, so.
All right, yes, you are. So but you're already touching upon what your doctor did and how your doctor assured you, and now we're moving more to the human side. How do we sustain the human side of medicine? And one of the things I was reading, and I'm going to read it to you, to everyone who's listening. It was a recent article in the Journal of the American Medical Association, and it was titled "The Promise and Pitfalls of AI in the Complex World of Diagnosis, Treatment, and Disease Management." And there was an interview with Dr. Ida Sim, who is a co-director of a program in computational precision health in San Francisco. But she tells us the patient-doctor relationship is about human relationships, and language is the mediation of that relationship. And now we have a machine that can do that. We were talking about Dr. Schapira, okay? So I want to go back now to the question in the title of this program, which is, how do we sustain the human side of medicine? So any of you can start, and because that's the question in all this. Anyone like to start?
Yeah, I mean, I think it goes beyond language, or maybe it goes beyond language in terms of what you say. There's body language, there's walking into the room and sitting down, there's listening. I mean, I guess maybe a computer can listen to you, but do they really sort of hear what you're saying? And none of those things the computer really can do at this point in time. You know, I'll never forget back when I was an intern, and I had the very first patient die on me. And this is something that I think probably most physicians go through at some point through their training. I was working on a cancer floor, and I had a patient who came into the hospital with pneumonia or something. I don't even remember the specifics. And this patient had cancer, sort of as a background. And so we were treating them. We were expecting the patient to be treated and to go home. And I spent a lot of time with the patient, the family, listening to them, hearing about the things that he liked, that he enjoyed. And really, I developed a great relationship with this person. And unexpectedly, one morning, the nurse called me, so-and-so has died. And this was my first patient death. And I remember thinking or feeling like I was a failure, like, oh my gosh, I did some, I couldn't save this guy. I did something wrong or something. And I walked into the patient room. I was dreading walking into the patient room and seeing this family again. And I walked into the patient room, and every single one of them gave me a hug. And that was so moving to me. And it made me really realize that what we do as physicians, it goes beyond the technical work that we do. It goes beyond the diagnostics. It goes beyond the medicines that we provide. We help provide comfort. We help provide dignity to people. And, I think that's where humanity is saved in medicine.
Any other? I know, Mary, you really touched on it already in your comments about, what it meant to have your doctor say, we'll take care of this. Yes, there's denials, and how much that was automated, even though you spoke to some young fellow at the other end of the line, that you knew and you trusted that your doctor was going to be there for you, the human side, and what it meant to you and how it sustained you. So you've kind of spoken to that already. I'm just wondering, with you, Noah, I mean, is this something that, and Dr. Touhey is talking about, is something that really is talked about during your time in medical school, this aspect of care?
Yeah, and I think increasingly so, that it's recognized in medical education now, that is building kind of a trusting relationship. And I think that's one thing that really AI can't necessarily do. I mean, you could have the most accurate model in the world that's able to diagnose you with things, and that model can't convey to someone that they care about them. And I think that's really like having that relationship where someone knows that, not just that they're getting accurate care, but that there's someone that cares about them and they're cared for. And building that trust, I think that's something that is really kind of the most important part of medicine, and you can't replace that with an AI. And I think especially trust is something now that people are kind of, to some degree, kind of losing some trust in the medical system. And I think you have to be careful with incorporating AI, that that's kind of something that naturally people have some distrust in. And so we can't let that kind of bleed over into those really important, sacred, trusting relationships that exist between healthcare providers and patients, because that's kind of at the core of everything.
Dr. Schapira, I know you pretty well, and I know.
Oh my gosh, Bern, we've been talking about this for decades. But I'm a little creeped out, frankly. I have spent, decades hopefully teaching and trying to inspire students and fellows and junior faculty about the value of connection and presence. My colleague here at Stanford, Abram Verghese, has a big program on presence, and the idea that, as everybody has said before, that it's about excellent diagnostic skills plus observation and communication and bonding and all of that. But I'm a little creeped out. I mean, I don't know if any of you have watched the movie Her, but that's, that was 10 years ago. And in that movie, the character Joaquin Phoenix develops this incredible emotional attachment to a bot. Of course, the bot's voice was that of Scarlett Johansson, so one can probably understand it. But I mean, I am a little worried about the runaway technology and the creation of alliances between vulnerable patients and AI forms. I am worried about that. So what do I do now? Well, I can't lie awake thinking about that because it's not going to go anywhere. My approach to this is, as with anything that's new, to create an alliance between myself and my patient first and say, we are going to use this tool, AI, to help us take better care of you, to make you safer, to make me faster, to allow me to spend more time with you without having to address paperwork, to make sure we don't forget something between us because we're just human and, our memories may fail us. So to build on everything that Mary is talking about, but basically bring it in the room and not put it between the patient and me, but very carefully put it there for us to use and hopefully for the patient to benefit.
Thank you. And actually, I wanted to get some questions in. People sent some questions in, and one of them really ties to what you're also talking about, because the question is, are there regulations in place that will allow me to know, patient, if AI is being used in my treatment?
Ask.
But yes. Go ahead. I'm sorry, Dr. Touhey. Go ahead.
I was going to say, as of right now, no. It really does come down to what Mary just said. You have to ask about it, and hopefully, doctors will be disclosing it as well. It's almost like any other component of a sacred principle in medicine, the informed consent, which is basically telling the patient what you're doing for them, why you're doing it, and what are the pros and cons of doing it. So we need to be doing that for sure. Now, I mean, interestingly, AI, the earliest uses of AI are kind of what I described previously, which is like the use of radiology. You know, your mammogram gets sent through an AI machine first to look at it and say, are there any spots on it that should be addressed, that the radiologist should look at? And I would have to imagine that almost every mammography center in the country at this point is using some type of AI to help help a radiologist make a diagnosis. Does that need to be disclosed to a patient? I don't know. That's a harder one. Probably much of that gets embedded into the report, which patients theoretically have access to. But does somebody have to say, look, I'm doing a mammogram, and an AI is going to look at it too?
Well, what you're saying is you don't have to disclose at this point, right? So it's back to what you said, Mary. It's like you need to ask.
And knowledge is power. Like when I got sick, I, just investigated as much as I possibly could about it. That's why I love this whole Speak Sooner program, because you have to educate yourself. You can't rely on someone else. Knowledge is power. I feel so strong about my care, and that it's a positive attitude that I have because of the team that I have around me that has made me survive, I think, because I am positive about it, because I have the best, where they get their knowledge and their whatever, I trust in them, but I do ask questions, and I think it's important. It's important because a lot of people, no offense, think of doctors as way up here, and that I can't question them, and I'm always like, I work for an agency, it's called Citizen Advocates. You advocate for other people. You have to advocate for yourself first. And that's what, just knowledge is power.
Good, thank you. So now I'd like to kind of shift a little bit, because in presenting this program on AI medicine, we thought it would be important to hear from the people on the street about their knowledge about AI in their medical care. Okay, and I say this was not a large sample, but we decided to ask the question, and there's the question. Are you aware of developments of artificial intelligence in medical practice? So let's hear what these people had to say.
Are you aware of developments of artificial intelligence in medical?
It froze. Okay, we have a little technical problem here. Okay. I'm sure we're going to get that figured out. Okay. Well, we're waiting for that to get solved, and here it comes. Okay.
Are you aware of developments of artificial intelligence in medical practice?
Quite honestly, I've not heard much about it. I mean, obviously I'm familiar with AI, and I could imagine that it's going to transfer over to the medical field, but I haven't heard a lot about specifically AI in the medical field.
Okay, based on that, do you have any concerns how it could be implemented going forward?
I certainly have concerns, but I'm also open-minded, and I know AI has done some pretty incredible things for other fields, so I could imagine it would cross over to the medical field quite well. Concerns would be the same I have with any AI for anything. So, I think as long as it's a measured approach with protocols put in place, it could probably benefit the medical field greatly.
Yes, mostly from the media. I'm aware of sort of two different directions it's going. One is sort of the administrative abilities of AI, and I sort of view those as positive. They're sort of helping doctors fill out forms and do patient reports, things that take up a lot of doctors and medical practitioners' time. What worries me is another piece of it, which is AI stepping in and doing doctors' work, and I worry about the loss of the human factor. But I'm hoping we're aware enough of it that we're preparing for that and not going to let that happen, so that AI always becomes more supportive than dominant.
No, I'm not aware of artificial intelligence being incorporated into the medical field. but it doesn't surprise me. I have concerns in general about the way AI is being implemented and whether or not we're doing it ethically, but I don't feel like I'm informed well enough to make a statement or have an opinion about it right now.
Frankly, I am not specifically in medical practice. There must be, for there are developments of artificial intelligence in every sector, but not specifically now. I have a lot of concerns, but most of my concerns are about like art and intellectual property. I don't, part of me feels like if there are ways we can get to quicker like diagnoses or to algorithms or all those types of things that are beyond me to help people, then why not? But if it's at the cost of human interest, then I'm a little wary, but not necessarily.
I am aware of artificial intelligence in medical practices. It's used quite a bit with not only, you can go from as simple as charting. You can go all the way up to doing the algorithms that will interpret complicated imaging. You can take that into also, if you go into insurance care, the algorithms that are used to determine actuaries and things like that. I always have concerns about the initial biases that are programmed in. And I'm going to be very honest, I also have concerns as AI, it's designed to perpetuate itself and to learn. I am concerned about what kind of safeguards are put in place to make sure that some people are automatically then denied certain healthcare procedures based on projected poor outcomes.
No, I'm not aware of artificial intelligence in the medical field. I don't have any concerns because I don't have enough information about it.
I ran into a few that were like on the medical end that were like, hey, analyze, like for example, analyze these symptoms, the person is this age, like what do you think the treatment is basically? And I feel like when it comes to the medical field, like this is where your prompt, what you're feeding AI, it can actually be pretty specific. Like terms in social media and promotion can sort of get lost, like create a post versus create a poster and all of these things. But I feel like in the medical field, the prompts that I've been seeing have been like kind of spot on. Another thing, another side to it sort of has to do with like people in the medical field not having to spend their time on stuff that they don't want to waste their time doing. Like I feel like, especially in terms of like writing like kind of more genuine medical reports, or even writing emails, like getting to the point where like a doctor or like anyone in the medical field that has to spend their time like actually doing their practice, being able to like cut down on the time that they need to like write emails or respond to emails. I mean, I think that's a big positive thing to it, really. And still, like I feel like right now AI still really needs like this human element to it. And like when a doctor is seeing the results from AI, if it didn't make sense to the doctor because they're a practicing doctor, they can change their prompt, they can change their question. So yeah, I truly think that this is positive, and I think that it's not really as scary as some people make it sound. And I'm really excited to see how are both of these, not industries, how this industry is going to develop with this new tool.
Well, like I said, this was not a large sample, but there were various responses to this question, which is really what we had hoped would happen. So let me ask our panel, in a few words, could you say what stood out about what you heard these people say, any particular person say? What comes to mind? Few words. Who am I going to start with? How about medical students?
Sure, I can go ahead. I guess one thing that stood out to me is in terms of what people think are the benefits of AI, that tends to focus a lot on, taking care of administrative tasks, doing things to allow providers more time with patients. I think those are probably like the most commonly thought of benefits of AI. I just kind of want to point out, I think, a lot of the concerns revolve around kind of the patient experience. But just as kind of adding another positive, I think AI actually can be used to improve the patient experience. And what I mean by that is I think for a lot of patients, just kind of navigating the medical system is really daunting and complex. And I think maybe a less often thought about use of AI is basically helping people navigate such a complex, confusing system. And what I mean by that is imagine going into your My Chart and you can just ask it a question. You can say, can you tell me all the times I went to the cardiologist in 2022 and what medications I got? And it can give you a list of that instead of having to sift through all of this information. Or, for example, a lot of patients I feel like they come out of a doctor's visit and they say, "Oh my God, what even happened in that visit? Like I don't remember anything. It was like there were so many confusing things. I was upset, and I was scared, and it's really hard to process all that information when you're feeling like that. So imagine going back and looking at your note from your visit, and it's just a bunch of medical jargon. AI can basically make that easier to understand, help you understand, and make a version that's more explainable, understandable. So I think those are some examples of things that on the patient side of things, AI can really help with. And I think that's maybe a less often thought of benefit. Obviously, there are lots of risks and we have to weigh those, but I think there's a lot of positive areas to think about on that side too.
So any other thoughts about what, again, a few words, I know you guys have a long explanation, Noah, because it was worth hearing, but what you heard about what these people are saying about their understanding of AI in their medical care. Your thoughts?
I mean, I'm definitely not surprised to hear people's takes. As a matter of fact, I was actually somewhat impressed by what some people's understanding of AI is and what some of the pros and cons seem to be. That was really a random distribution, huh, Bernie? They seemed pretty informed, about the risks of biases and feeding it data and how machine learning kind of develops itself and can with potentially unpredictable consequences. What's going to come out of it. So I actually thought that sample that you got seemed pretty well informed, and I'm not surprised by their concerns in any way.
Okay. Any other thoughts anyone would like to add? Because otherwise we'll move on to what's connected to this video and what they had to say, and that has to do with how do we educate patients, healthcare providers, and actually the public about the role of AI in medical care. So that's a whole topic, and we'll break it down, and we'll start with the question of how do you educate healthcare providers, again, about the role of AI in their care. The question came up before about disclosure, not disclosure. But let me start actually with Dr. Schapira.
No, I can give you an example. For instance, I was trying to think about an example in my own environment because, instead of being theoretical, something that I've experienced here, I have quite a few colleagues here who are very much into, these new technologies. And one group for many years figured out how to extract data from these medical records using all of these techniques that we lump together as AI to identify people who probably are within the last, few months of their lives. And this may be of interest to your initiative to have people speak sooner and, really begin to think about things. But as a result of, testing them and validating these algorithms, that they were able to create with, huge amount of effort, huge amount of data, they now send a nudge to the clinician And they say our algorithm has identified that because of all of these criteria and our validated tool, your patient is at risk, for, being perhaps, a few months from the end of their life. And that should then trigger the clinician to have conversations or review things. It may not be necessary, but in some cases that prompt may actually set in motion a series of conversations, a referral to palliative medicine, a whole bunch of things that we feel that, should be considered. So that's one example in our institution where AI has changed care. And because I work in oncology, I work with populations of patients who, are at risk and know that they are at risk, but sometimes, we're not quite sure where they're at. And these algorithms help us so that perhaps we extend an earlier referral to palliative medicine and consideration of more detailed communication and support for families. So that's one example, Bern.
It is a good example, actually. I was going to ask you, Noah, again, back to the position you're in now in medical school, right? So, and you actually answered it a little bit earlier when you said something about there really isn't much on AI in your curriculum, and yet it's a burgeoning, emerging, field in medicine, and so maybe you have some thoughts about perhaps what should be in medical education and curriculum around AI. So what are your thoughts about that, Noah?
I think every healthcare provider should have kind of a basic understanding of how it works, how these models are gonna come up with suggestions, and because I think it's kind of it's important for explaining it to patients. If patients are going to trust medical providers to give them the best care, I think it's kind of on the providers to have at least a basic understanding and be able to kind of relay their trust and their understanding of the systems that we use. And so, yeah, I think going forward, I think not just understanding like how to use it, but like at least a basic understanding of how it works is going to be pretty important.
Both, actually, right? How it works, but how to use this information, like
Yeah.
Right? This nudge or this prompt, based on all the data about patients at this stage, of illness, and the doctor is given this, this piece of information that may be very and should be very useful in terms of planning of care. So, what about you, Doctor? In terms of you, because you teach medical students and residents,
Right.
How do you see, educating this again? This new group who are coming up about AI and what part it plays, what role it plays in medical care.
So it's a good question. I mean, I suppose we probably talk about it in passing when an application of it comes about. In some ways, I suppose you could think of it like other technologies within medicine. And maybe an example is like an MRI machine. I think if you were to ask most physicians or medical students or nurses how an MRI machine works, probably very few of them could tell you, well, it's a big magnet that aligns the spins of various electrons. It's just not sort of within the wheelhouse of people. And yet we all use MRI machines. We all trust the results that come out of MRI machines. So in some senses, I guess what I'm saying is that maybe we don't need to educate deeply into, okay, well, this is how an AI works. This is how an AI is developed. But we should just understand what's the application of the technology. So, with an MRI machine, even though physicians can't tell you exactly what the physics are of how the machine works, they'll be able to tell you, well, what do you use an MRI for? What are the things that an MRI is good at detecting? What are the things that an MRI is not so good at detecting? And so what kind of information can we get out of the machine? Why would I order an MRI? Why would I not order an MRI? And so probably the same is true of artificial intelligence when we make use of it. Understanding the pros and cons, what are the pitfalls of using an artificial intelligence? That's, I think, what I would focus on teaching students, those who aren't necessarily interested in dedicating their careers to understanding the AI. Let's teach them the sort of the practical aspects of it.
Yeah, it ties in what you were saying, Noah, about having some understanding of how it works. You don't have to know all the scientific, technical components, right? But because I'm just thinking about you, Mary, as a patient, a doctor comes up with a recommendation, right, for treatment, and they ask the question like, where did this come from? I mean, how did you decide? And the doctor may say, well, I was doing some research on it, and I came up with this from this particular AI program or information computer, from my computer, right? And so it just makes me wonder that there would be some more gravitas, perhaps. I'm not sure that's the right word, but about making that kind of recommendation with the physician, clinician, really having an understanding of how that knowledge is produced. Because you're talking about being the patient, right? And the comfort level, because you're talking about this, and it's so critical, the relationship and the comfort you have with those caring for you. And if you come into contact with a clinician, physician, and you ask the question, like, how did you come to this? And they say, well, I checked it out on the computer, and could you explain that to me? And back to what we're talking about, at least have some knowledge, because, right, you're shaking your head, Dr. Schapira.
I mean, if you ask me to explain how the linear accelerator works, or a patient who's getting radiation, I can't do that.
Mm-hmm.
I can't. But there are physicists in the room who can. So at some point, I think this is like, you accept that you may be an expert in your field of discipline, and that you surround yourself with others who are, honest, evidence-based experts in theirs. And at some point, the currency is to be trust, right? Because I can't be asked to explain how every drug works or how radiation works. I have data that would back my recommendation that this particular treatment is effective in treating X, but I can't explain, at a cellular, molecular, or genomic level how everything works, Bern. So I think that standard would be too high, frankly.
Well, like when my doctor had recommended radiation beads put into my liver, he sets me up with the doctor that's going to do that. So I take a trip down there and I meet with them and they explain it to me. So I'm searching out this information, and then I feel, this is why. So it's just, once again, educating myself, but having the faith in my doctor to send me to this other doctor, and then I can ask them questions. So they're collaborating on the phone, on the computer, without, not me included, but then I am included in it. So that's what I love about that. So
good. You just segued us into this next question, which is about how do we educate patients about the role of AI in the care. And again, this is kind of a crossing back and forth. And Dr. Schapira is saying, even for clinicians, like it's a little too much. But I'm just thinking, again, maybe being a little provocative, but this is such an emerging field, and there's so much out there every day, right? And if people are in that world where they're patients, no less the doctors, and if they have an interest and they want to know about it, how do we help them educate, what AI does? I think there's, back to what we talked about earlier, that there's potential biases with what may be in some of the recommendations, perhaps. At least ask the questions, right? Back to what you were saying, Mary, the kind of transparency about this, including a physician saying, I really don't know. I don't know how exactly. I know what the recommendations are, what the data is showing, but I don't know how it arrived at this particular, answer. But it just raises a whole question in terms of our program this evening to be thinking about and discussing, like, so how do we educate patients on this whole new field of AI in their care? So I'd just like to, kind of leave with you. Maybe Dr. Touhey, you have some thoughts about that?
Yeah, I suppose it's got to be individualized. It's like a lot of the other things we deal with in medicine. There's a lot of very technical things that we work with on a day-to-day basis, and patients. Some patients, you you'll start explaining to them what they're going to be treated for, and they'll just say, doc, I don't care. Just if you think it's best, just do that. And then you'll every so often you'll take care of like an engineer who's going to want to know like every precise detail of what's going on. And so what I explained and then you have patients who are in various stages in between. So what you explain to people is really kind of very much customized based upon their own knowledge, their own understanding, their desire to be engaged in that type of what understanding what is the underpinning science to their treatments. The same is true of medications we prescribe. Some people will just say, okay, yeah, if that's what you want to prescribe me, great. And other people will say, well, what's the data for this? How does it work? What's the percentage chance that I'm actually going to be better if you prescribe this medicine? What's the chance that I'm not going to have a stroke compared to if I don't take this medicine? So some people are more interested in those types of things as well. So we dig into that a little bit deeper, depending on if that's what the patient wants to know about. So I guess that's sort of what I would say is it just has to be a little bit individualized to the patient.
What you're talking about too is you're talking about it coming from the patient's interest that they want to know, and then you can respond in what knowledge you have, and perhaps they want to know more. Where is this data from? You could tell them that. But it's what you're describing is how you're really paying attention to what is it that the patient is asking for, as opposed to volunteering that information, knowing that you may not even be able to explain all of it, but it's part of the medical science, and it's been proven and so forth. But I guess where I'm leaning now is the importance, and Mary's really talked about it many times this evening, about patients being the ones to realize that they need to ask the questions. Some may have no interest, say, doc, whatever you said, right? Or I really want to know more. But it comes, most often it does come right back to the patient initiating, right? And opening these conversations in terms of what interest they have and how much interest they have in certain, in their care.
It's also possible your patient knows a whole lot more about AI than you do. I mean, people I'm surrounded by here often do. So I think that's the other piece, which is, what we haven't defined, and we're not going to solve it in this call, because Noah has just told us that even his faculty at one of the country's most prestigious medical schools does not have an approach, is we haven't determined the level of proficiency that people need to have, or we haven't developed as a community of physicians and nurses and healthcare professionals, sort of what we want the population, the lay population who comes to us to understand about how we apply these new technologies. We're not there yet. So that's part of the reason why I think this conversation is so exciting, because I think we all need to get involved. Because if we all want smart, judicious, wise, ethically minded people to be part of this conversation, now's the time, because we don't yet have a code here.
And then, that exact topic is under heavy discussion and conversation with AI in general. When it comes to the application of AI to any field, how do we approach it? 5 years ago, no one had ever heard of AI as science fiction. Now it's everywhere. So it's just really blossomed in the past few years, and in every field, they're really struggling and trying to figure out what's going to be the best use of AI. How are we going to put appropriate constraints on it? How are we going to make sure that it's used in a proper manner? How are we going to make sure that biases don't influence the AI's results? So these are all important questions that are being dealt with across the field, and I don't think we've solved it in any field really.
No, and then the big question in AI, at least, you know, what I see also is the tension between the for-profit and not-for-profit sector here. And I think that's where, you know, medicine definitely needs to have an opinion, but medicine hasn't yet been consulted.
And the government is doing some work right now. There's some rules that are being sort of tossed about at the federal level with regard to the use of artificial intelligence in medicine, and specifically with regards to transparency with how those algorithms are developed. And, you know, to your point, Dr. Schapira, you know, maybe it's not understandable by everybody who opens up the article or whatever it might be, the publication on how the AI works, but at least it's out there, and people who can understand AI algorithms can actually read it, and there's some transparency there. So this is one of the things that the government is looking at, is enforcing transparency for AI algorithms that are used in medicine.
Actually, one of the questions that came in is kind of in this area. It's like the question has to do with, how is the tech industry attempting to address the hallucination problem, especially when it comes to healthcare and accuracy? Back to, you know, maybe the federal government getting involved in some of this, but I mean, that's a question, because that sometimes what gets produced is not accurate, and then you're left with inaccurate information, right? And then you have to vet it yourselves. Oh, you know, I'm sure you will, but there may be people in the field who don't. So it's, again, it's just, it's you know, be aware, you know, just be aware. Ask the questions once again, you know, where does this come from? Because there's the question, you know, and we know that sometimes what comes out is like, where did this hallucination, where did this come from? You know, and yet it on the surface appears to be, you know, fact, right? And so, again, it's a mutual, it's the back to the relationship really between, you know, the patients and their clinical team, right?
Yeah, I'd just like to jump in really quickly and say I think it's important to, as healthcare providers and having that trusting relationship, to be able, maybe you don't need to be able to understand how it works in depth, but I think you do need to be familiar with evidence. And I think the prospect of AI is very exciting and scary, and we have to remember that, you know, before implementation, any AI that's going to be used, any of these models, like, is going to go through extensive testing, or at least it should. You know, just like any cancer drug, just like any study of any procedure or new surgery or anything like that, there should be strong evidence that it works. And I think as providers, being able to, I guess, explain to patients and convey that you trust the evidence before you use something is really important.
It does make one wonder if there's going to be like an FDA clearance or something for AI in the future.
I was thinking of that exact thought, because the way Noah was talking about it, he was almost talking about, if this is a new drug, it has to be effective, it has to be affordable, it can't be toxic. So you weigh the side effect profile with the potential benefit, and then, you know, you also need to, I think these days, also think about the cost. But I'm not quite sure this fits in with the FDA portfolio, but there's got to be some other technological oversight that has to do with human services, perhaps. But I don't know. It sounds to me like Jason knows more than I do about where this stands with the government.
Yeah, I don't think any of that has sort of been decided as of yet. You know, in some ways you can think of it as like a medical device. So like the FDA monitors like a pacemaker, for example, and ensures that pacemakers are effective and they do what they're supposed to do, or diagnostic equipment, lab equipment, that type of thing. There are governmental regulatory agencies that oversee those things and make sure that when a hospital is sold a piece of equipment that purports to tell you what the patient's level of oxygen is in their bloodstream, it actually can do that. So the manufacturers have to prove that. And I mean, I think it would be great if the same were true of AI technologies as well.
And then you can think about, where the boundaries are. This is not a US product, and it would be interesting to think about how other countries are thinking about this as well. Again, if there's going to be a profit that is made from these technologies, as there often is in medicine when there is a new device or a new drug, the competing interests of, protection of human subjects and possibly for profit. So I think this is a very complicated discussion.
Well, it really is. I mean, because it's the other piece to this education. We talked about healthcare providers, and we talked about patients, and then there's the public, which is really what we're talking about in many ways right now. How do you educate the public? And the federal government is beginning to take responsibility for that, because again, the dangers that conceivably could be there with, this is whatever the AI produces, this is, may not be safe, and who's safeguarding the public? So there really needs to be involvement on all levels here. And it sounds like what you're saying, I think I read that President Biden is spearheading some movement here, or the government around this whole issue, and it's important. Very obviously, we're talking about it. But we also learned this evening that regardless of the source of clinical information, whether it's AI, that what's important, and we've talked about it again, but I think it's to summarize that it's about communication, and whether it's communication from the direction of the clinician or communication from the direction of the patient, that for someone who's in that place in their life where they are a patient, how important it is, and Mary can speak to this, and she already has, of really understanding, right, what their health status is, and to understand what the treatment options are, and to understand what they need to do, what they can do to manage whatever is recommended. This is really critical. And yes, it's complicated, and we've had other of these programs around health literacy issues. So it does, it does move into that territory in terms of what someone understands as a patient. But it is about understanding this and feeling responsible for your own care, and being able to ask the questions as you do, Mary. And listen, AI presents many, many opportunities we've been talking about this evening, and also many challenges, right? On many different levels, right? But the bottom line, the core to this is about effective communication, and it's about, again, what's been mentioned, trusting, the patient trusting the clinician, and the clinician trusting the patient, both ways, right? And these are foundational pieces of medical care. You all know that, but I think it's important to really identify that, because again, it's like, how do we sustain the human side? And the common thread is about being able to really talk with one another and really understand. I mean, especially these days with people who are clinicians and what they're going through. The last program we did was about empathy, in medical care, and the title was something, and then it was like a two-way street. So I think it's important because it's all about building relationships. And so as much as we're talking about AI, whatever information from wherever it comes from, right? And you've talked about this, really, all of you, it comes down to that trusting relationship based upon that there's open and honest communication taking place, okay? And so with that in mind, and it's been referred to, actually, Mary and Dr. Schapira referred to this. It has to do with what we as an organization has developed in terms of a guide that we've developed. And you're going to see on the screen, there it is, right? Because this is a tool that, again, you've been talking about this, the human side of medicine, and this is a tool that we developed. It's called Speak Sooner, A Patient's Guide to Difficult Conversations. And what it does, and it's back to prompts. Dr. Schapira talked about that in her institution, that the physicians or clinicians really are given prompts. So they're really kind of given information that really will help them to open up some conversations with their patients, and then be able to discuss, what the options are, what's available, sooner rather than later. As we say, speak sooner. And this is what this guide does. It really prompts patients to think about and communicate their questions and their concerns to their healthcare providers. And what we're finding is it does lead to a better understanding of their diagnosis and treatment options. At least we hope so, and we have some evidence to that effect. And ultimately, that patients and their loved ones can make informed decisions about care. That's what really matters when it comes down to it. And I can tell you that we're really pleased that we have programs, or actually pilot projects going on at 2 different oncology practices using this guide, and we're learning a lot about it, how it really works in real-time practice, and how it not only benefits the patients, but what we're learning is how much it actually benefits the clinical team in terms of really helping to prompt conversations with patients, but also among themselves. And that those programs are taking place right now as we speak at Adirondack Health in Saranac Lake, and in Rutland, Vermont. That was a tongue twister, wasn't it? And for you who are attending this webinar, you should know that this guide is available for free online, and it's also available through our organization, the print copies, through speaksooner.org, which is our website. There's like one other question before I kind of just wrap it up, and I really liked that this question came in. As a patient aged 83, I ask about helping the elderly about their independence, one factor of which is negotiating contact with medical offices and records. Considerations of such things as palsied hands, trying to direct a cursor, eyesight and size fonts, lengthy protocols for passwords that lead to frustration and giving up are examples. And what made me think about is, so can AI help with someone in that situation? And how would that work? Here's somebody who is challenged, right? In terms of accessing information, wanting to be involved, but we're talking about an aging group population. So any thoughts about how AI could help someone like this as we're brainstorming about this, or maybe it's even available, where this person is having trouble just accessing data on their computer? Is there AI programs that could help with that? Yes, Dr. Touhey?
Yeah, I mean, there's all AI is everywhere these days, of course. So you can find AI. If you're looking for AI to do something for you, you can probably find a tool that'll do it these days, at least in some rudimentary fashion.
Mm-hmm. Okay, sounds good. So I guess I'm very aware of the time, and I just wanted to take the last couple of minutes and actually thank all of you, our panel, who've been extraordinary, insightful and informative, and just making us really think about what we're all facing with this movement of AI becoming much more involved in our medical care. So I'd like to thank the panel. So maybe we can get that slide up, and there you are again, Noah and Dr. Schapira and Mary and Dr. Touhey, and there's me at the end. Yes, I'm the moderator. But also I wanted to take a moment to just really feel grateful to our interviewees, which include all of the panel, but also there was Adele Jasperese, who you saw in the video and really added a lot about the concerns around AI, and certainly in her work as an attorney at the Harvard Medical School Center for Bioethics. And I also wanted to thank Dr. Bruce Nash for his thoughts and really his experience in working on the health plan side of things and what they're looking for in terms of AI and trying to improve a lot of efficiencies in medical practice. And certainly at the bottom there, the citizens of Bennington County who you saw on the street, who shared some of their views about how aware they were about and surprisingly fairly aware of how AI is playing a role in medical care. And so once more, the sponsors, which I've named, I want to just again thank them. And then finally, what I'd like to do is just let you know that if you're interested in what our work is and want to get updates, certainly this program has been recorded, and if people have missed it and they want to let people know it's available, that they would go to speaksooner.org. It just makes it a lot easier if you sign up. I know we're always a little hesitant to give our emails, but it would make it easy for you to find out that the recording is available. And if you're interested in supporting any of our future programs, we always welcome donations, again, at speaksooner.org. And for us at the Center for Communication and Medicine, we really thank you all for attending, and we hope to see you again in other programs. And just one thing to remember, and that is good communication is good medicine. Thank you all.